My name is Jenna Hopkins, and this is my Living with Long COVID series. This presentation is about mast cell disorders. We're mostly focusing on MCAS, which is mast cell activation. This is the third in the series. So the other two parts are post-exertional malaise and hypermobility and EDS. So please go back and watch those if you haven't already. Mast cell activation syndrome is a condition characterized by the inappropriate activation of mast cells. This is a type of immune cell that plays a crucial role in the body's allergic responses. In individuals with MCAS, mast cells release excessive amounts of various chemical mediators. This includes histamines. MCAS is the most well-known mast cell disorder, and it is linked to long COVID. So in MCAS, mast cells become hyperresponsive and release these substances inappropriately, even in the absence of a true threat. This is really common after head injury and viral infections. You might even be predisposed to MCAS. We think about 20% of the population is. So if you have a history of allergies, asthma, postnasal drip, migraines, IBS, or excess stomach acid, you might have overactive mast cells, especially if this has gotten worse since you've had COVID. Symptoms are fatigue, hives, rashes, itchy throat pain or chronic cough, insomnia, brain fog, digestive issues, and an increased sensitivity to alcohol. So systemically, it's going to look something like this. The symptoms of MCAS can be really diverse and affect different organ systems, and so that's really challenging to diagnose. Common symptoms include those skin reactions like rashes, itching, and flushing, gastrointestinal issues like abdominal pain and diarrhea, respiratory symptoms such as wheezing, shortness of breath, cardiovascular symptoms, and neurological symptoms like brain fogs and headaches. The Queasy questionnaire, that's QEESI, and the mast cell mediator release syndrome survey can help identify different reactions. Just know that everybody kind of has a bucket, and that bucket can fill up over time in terms of their mast cell bucket. This would be similar, but a different bucket than inflammatory bucket. So things that may trigger you at some times may not trigger you at other times, depending on how full that bucket is. COVID came along and filled that bucket up pretty full for a lot of people. So that is why there are studies out showing increased sensitivity to alcohol, for example, because alcohol is high in histamines. Other potential triggers are extensive, and they include, but are not limited to, food, physical exertion, scents, temperature extremes, sense stressors, infections, and sunlight. It's also extremely important to identify and eliminate any other root causes or triggers. So that might be allergens, mold, and toxins. If these are not addressed and stabilized, mast cell disorders can worsen and bring about additional symptoms. People frequently become increasingly heat and exercise intolerant with chronic fatigue and post-exertional malaise symptoms. Diagnosing MCAS can be really complicated because of the diversity of symptoms and the lack of specific laboratory tests. So a plasma, histamine, and tryptase level is a common lab that may indicate that this is an issue for you. There are also genetic variations that predispose people to MCAS. For example, there's a duplication in the tryptase gene TPSAB1 that might result in MCAS in POTS because you have about 50% more of those tryptase genes. A company called Gene by Gene can detect tryptase gene mutations with a cheek swab. It is also worth your time to check ferritin levels and B2, B3, B6, and B12 vitamin levels to see if you have correctable deficiencies. Immunologists and allergists are the people who deal with MCAS, but it is a pretty specialized field, so you want to check that your immunologist and allergist is familiar with and comfortable treating MCAS. Physicians often rely on a combination of clinical evaluation, a detailed medical history, and laboratory tests to rule out other conditions. Management of MCAS typically involves identifying and avoiding triggers, along with medications to help stabilize mast cells and alleviate symptoms. Symptoms should decrease in frequency or severity with anti-mediator therapies. Antihistamines, mast cell stabilizers, and medications that reduce the production of certain inflammatory substances are commonly used. MCAS is intricately linked with gut health, so that is a priority. So here we've got some common over-the-counter medications that you're able to purchase. It is very common for people to take an H2 antihistamine such as famotidine and an H1 antihistamine such as Claritin, Allegra, or Zyrtec to see if that can help to stabilize your mast cells. That is kind of putting a Band-Aid on it. You really need to take that second step and figure out what can help your gut and what can additionally stabilize you. There's prescription medications on here too. It might be worth your time to talk with your doctor about if you're already on an allergy medication or if you are already taking an inhaler, if these are worth trying for you. And then there are some herb and supplements that might have positive outcomes in MCAS patients, and they might be helpful as well. That includes liposomal quercetin. You can take up to 1,500 milligrams daily in divided doses, bromelain, vitamin C, and then perilla oil. You might also take cod liver oil that has a little bit of vitamin D and vitamin A in it, and then other oils which can help to stabilize, such as krill oil or mussel oil. Raw honey and local bee pollen can also be helpful, and there are many teas that can have some herbals which can help stabilize your allergies as well. I myself like nettle tea. You want to make sure your air is clean, your water is clean, and then of course this can be worsened by pesticides, so if you can buy clean food or organic, that would help out as well. I really like this QR code. It has a link to an amazing introductory booklet, and that has a lot of ideas for self-management. Again, gut health is intricately linked to this. Food, which may have been previously healthy and helpful to your system, might now be triggering unwanted reactions. So sometimes people's gut has slowed down, so they need to look into low FODMAP diets. Many people have an increased reaction to histamines in their food, and that's going to indicate a low histamine diet. You might be sensitive to some of these other food additives as well. So I recommend going through and doing a gut healing protocol when you are able to. The first thing you know is that if you're having signs of constipation, IBS, leaky gut, and SIBO, those are really common in dysautonomia and long COVID. They might even be a root cause of dysautonomia and mast cell activation syndrome. So work on your gut health helps your body to heal. It helps to decrease inflammation. The R's of gut healing are remove, replace, reinoculate, and repair. Removing, this is basically an elimination diet, so you should get rid of anything that might be triggering to your system short term. So this is usually 2 to 4 weeks, and it works best if guided by a nutritionist. You should also avoid medications that worsen gut health in that time, such as antibiotics, aspirin, and ibuprofen. The most common food irritants are gluten, corn, soy, dairy, and sugar. But people with dysautonomia or gastroparesis might benefit from low FODMAP and use of digestive enzymes, and people with MCAS might benefit from an antihistamine diet. Down enzymes are also very helpful if you are eating some histamines, that they reduce or eliminate the reaction that you would get from that histamine. Common high histamine foods include aged and fermented foods like yogurt, cheese, smoked cured meat, seafood, pickled foods, wine and beer, kimchi, kombucha, and sauerkraut. Food gathers histamine as it ages, which means that even leftovers, if it is in your refrigerator, is going to gather histamines over time. So I encourage people to use a freezer instead of their refrigerator for their leftovers. Other high histamine foods are canned fish, canned meat, strawberries, nightshades, including tomatoes and potatoes, avocados, preservatives, vinegar, and coffee and black tea. There is a food compatibility list from the Swiss Interest Group, and you can look that up online. And there are also helpful apps such as Food Intolerances, CaraCare, and Fig that are available for free and might help you with this portion of the elimination diet. Replace means that you are basically adding things in that help with digestive function. Some of those things might be digestive bitters and digestive multi-enzymes, and then that DAO, which helps to break down histamines. Adding food or supplements that can help with gut health or nutrient deficiencies. Reinoculate. This is where we want to talk about how to build up that gut microbiome. The single strain L. rhamnosus, LGG, is very helpful for MCAS, and it tends to be MCAS safe. I would eliminate all other probiotics at this time, as they can sometimes affect your tolerance because they do come from fermentation process. Nancy's Organic Kefir is available at Sprouts and some other health food stores, and that is very high in L. rhamnosus, LGG. If you tolerate that well and want to take a multi-strain capsule, I like Probiota Hist X if your tolerance is a little bit higher. For the repair section, again, you want to make sure that you have sufficient vitamin D, magnesium, vitamin C, and zinc. Those are essential nutrients for gut health. Turmeric, chia, aloe, pectin have also been shown to help with constipation and diarrhea. Foods high in amino acids like bone broth, chicken, and collagen can help repair the gut. The final step is to rebalance, and this is all about lifestyle. So sleep, diet, emotions, physical activity, and stress all play a role in your digestive health. Again, this is really hard to do on your own, so don't feel like when you feel at your worst that this is something to tackle, but maybe create a plan with a partner, a loved one, or a nutritionist to help to figure out how to tackle your gut health. I wanted to let you know about these mast cell activation resources. That includes the Mastocytosis Society, mastcellaction.org, mastcell360.com, tickedoffmastcells.org, and there's a lot of books with antihistamine diets and meal plans available online.